Have you ever wondered what medicine will look like in 50 years? Forget what you've seen in sci-fi movies. The future isn't about shiny robots making coffee. It's about a silent, powerful revolution happening right now. Driven by artificial intelligence, AI is set to completely change how we fight disease, turning today's dreams into tomorrow's reality. This isn't just about new gadgets. It's about a deep fusion of data, algorithms, and human expertise working together to diagnose, treat, and prevent illness with a level of accuracy we've never seen before. Get ready, because the most exciting chapter in the story of human health is just beginning. Let's start with diagnoses. In the future, a doctor's main role won't be guessing what's wrong inside your body, but rather verifying the incredibly detailed reports that AI provides. Diagnosis is evolving from an art form into a precise science. The greatest power of AI is its ability to analyze massive amounts of data at a speed no human can match. Think about medical imaging. In radiology and pathology, AI models will spot the tiniest, almost invisible patterns in Mr. Is, CT scans, and tissue slides. They allow find early signs of diseases like breast cancer or diabetic retinopathy years before they would normally become visible to the human eye. This means catching diseases before they even have a chance to take hold. And it goes even deeper, right down to our DNA. Soon, having your entire genome sequenced and analyzed will be as common as a routine blood test. AI will read your genetic code, not just to identify your inherited risks, but to predict exactly how your unique body will react to things like diet, lifestyle, and environmental factors. It's like having a personalized roadmap for your health, allowing us to prevent diseases before they even start. But where will all this data come from? You're probably wearing the answer right now. Our smartphones, smartwatches, and wearable sensors will become our 24/7 health guardians. These devices are constantly collecting information, your sleep patterns, the stress levels in your voice, even tiny changes in how you walk. AI will analyze this constant stream of data, using it as digital biomarkers to sound an early alarm bell for potential health issues, long before you'd ever think to schedule a doctor's visit. Now, let's talk about treatment. This is where AI's impact will be truly transformative, especially when it comes to personalizing medicine and discovering new drugs. We're moving away from a one-size-fits-all approach. In the future, every patient will get a treatment plan that is uniquely theirs. I will create a digital twin of your specific illness, using your genetic, protein, and metabolic data. With this virtual model, Dr. Zor, even the AI itself can determine the perfect drug, the perfect dose, and the perfect timing to maximize effectiveness while minimizing side effects. This will be a game changer in oncology. For cancer patients, AI will analyze thousands of potential chemotherapy or immunotherapy combinations in a matter of seconds. It will predict which specific treatment will be most effective against a particular patient's tumor cells. This means no more wasting precious time and enduring the harsh side effects of treatments that were never going to work in the first place. It's the dawn of true precision medicine. And what about finding new drugs? The current process is incredibly slow and expensive, often taking over a decade and costing billions of dollars. AI is about to put that process into hyperdrive instead of the old trial and error method. AI algorithms will design brand new molecules from scratch, or sift through vast libraries of existing compounds to find the perfect candidates to target a disease. But the real revolution is in virtual trials. Instead of going straight to human testing, many early-stage drug trials will be conducted on virtual human models created by AI. These models, built from massive data sets of genetic and biological information, will help us weed out ineffective or unsafe drugs early on. This will drastically lower the failure rate in clinical trials and ensure that only the most promising therapies ever make it to real human volunteers. AI's influence doesn't stop at pills and prescriptions. It's also set to fundamentally reshape surgery, rehabilitation, and even our mental well-being. Surgeons of the future won't work alone. They'll be assisted by hyper-precise AI-powered robots, like next-generation versions of the Da Vinci system. AI will guide the robot's hands to make incisions, stitch tissue, and control bleeding with a level of steadiness and accuracy that's humanly impossible. No tremors, no fatigue, no errors. For some routine procedures, these robots might even operate autonomously, with the surgeon supervising, making surgery safer and more accessible than ever before. And looking even further ahead, imagine nanorobots. These microscopic machines, guided by AI, could one day be injected into our bloodstream. They would travel through our bodies to find and destroy cancer cells directly or clear out plaque from our arteries, all without the systemic side effects of conventional drugs. It sounds like science fiction, but it's the direction we're heading. For those living with chronic conditions like diabetes or heart disease, AI will become a constant companion. It will monitor health data in real time and provide continuous, personalized advice on diet, exercise, and lifestyle to keep the condition stable and prevent serious complications. But perhaps one of the most profound impacts will be in mental health. AI-powered virtual therapists will be available 24/7 by analyzing vocal tones, text, patterns, and emotional cues. They can offer immediate support and intervention for anxiety, depression, or even a suicide risk. This will break down barriers and revolutionize access to mental health care for millions who currently suffer in silence. Of course, this incredible future isn't without its challenges. We have to navigate some serious ethical questions. First, there's the problem of accountability. If an AI algorithm makes a mistake in a diagnosis or a treatment plan that leads to harm, who is responsible? The doctor who used it, the company that created it, the hospital that bought it. Many AI systems operate like a black box. We get the answer, but we don't always know how it arrived to that conclusion. Making AI's medical decisions transparent and explainable is absolutely critical for building trust. Then there's the issue of data privacy and equality. When our most intimate health and genetic data is stored in AI systems, protecting it from hackers and misuse becomes a monumental task. We must ensure this data is secure. Furthermore, there is a real danger that this technology could widen the gap between the rich and the poor. If only wealthy nations and individuals can afford AI-driven healthcare, we could create a new form of health disparity. We have a moral obligation to ensure that the incredible benefits of medical AI are available to everyone, not just a privileged few. So, will AI replace doctors? Absolutely not, but it will change their role forever. Doctors will evolve into data scientists, AI supervisors, and most importantly, the compassionate human connection in healthcare. Their job will be to interpret AI's complex findings, navigate difficult ethical dilemmas, and provide the empathy, understanding, and human touch that no machine can ever replicate. The future of medicine. Powered BI promises a world where disease is no longer an unpredictable tragedy, but a manageable risk. A world where diagnosis is instant, treatments are perfectly personalized, and both our lifespan and our quality of life increase dramatically. This revolution requires us to be thoughtful, to be cautious, and to be guided by a strong ethical compass. AI is here, and it's giving us the tools to write the next and best chapter in the story of human health. Let's make sure it's a story that benefits all of humanity. Thanks for watching. If you found this glimpse into the future as exciting as I do, don't forget to like, subscribe, and hit the bell to stay updated on how technology is shaping our world. See you next time.